The skin industry has evolved from basic deep hydration of the skin to cellular signaling and deep tissue repair. The whole concept of exosomes and PDRNs have come into picture lately, and industry is flooded with so many serums. Let me tell you, as a dermatologist, the basic difference of your exosomes or PDRN treatments that you do at clinic versus the ones that come in a bottle as a serum that you can use at home. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist at Neya Dermatology Aesthetics. Today, let me explain you what exosomes and PDRNs are and if you should opt for in-clinic procedures or use it as a serum at home. Exosomes are not cells themselves. They are the text messages or USB drive that cells use to communicate. When an aging cell receives an exosome from a young healthy stem cell, it downloads a new set of instructions telling it to act young again. So in this whole process, there is stimulation of new cells, neocollagenesis, automatically there is skin repair, and ultimately your skin starts looking better and younger. PDRN, which is actually Polydeoxyribonucleotide, everybody knows the famous Salmon DNA facials or Salmon DNA. In this, the base structure closely mimics human DNA, making it highly biocompatible and safe. This actually reduces the inflammation and stimulates certain growth factors in our skin, so it helps in tissue repair. So this whole process not only hydrates your skin, it also thickens the damaged skin barrier and aggressively fades away the redness and post-acne erythema. This is the reason we always combine this procedure with certain extensive treatments that we do in the clinics, like a CO2 laser or even microneedling radiofrequency, where there's a lot of tissue repair happening. This helps in aiding to the entire process of new collagen formation and tissue repair. So now, to address the elephant in the room, you might ask me, why can't you use a serum that has exosomes or PDRNs at home, and why should you go to a clinic to get these procedures done? The main difference with these two products is that the molecular weight of the product. For any product to penetrate your skin, the molecular weight of the product should be less than 500 Daltons. Exosomes and PDRNs are high molecular weight products. They cannot penetrate the skin barrier and directly go into the deeper layers of your skin. So when you're using this product, we have to create micro channels in your skin for these products to penetrate the deeper layers. So we doctors always combine this procedure with something like a microneedling radiofrequency, or a CO2 laser. So this combines two different procedures, gives better results, also helps in better penetration of the product. As a dermatologist, I can say that do not buy these expensive serums that say that they have exosomes or PDRNs in it. I would say keep your routine simple and be consistent with it. For that extra boost, visit your qualified dermatologist, ask their suggestions, and if you're a right candidate for exosomes or PDRNs, and if needed, get an in-clinic treatment with these products. If you want more information about exosomes or PDRNs, please comment below, and if you like this video, share it with your friends and subscribe to my channel.